Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about the fourth module of the Section 2 in the IBMS digital registration portfolio called Performing Standard Investigations. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the learning outcomes, different types of evidence, and HCPC SOPs that need to be met in this module. We will discuss evidence justification and IBMS evidence suggestions. I will share with you some of my evidence ideas, and we will finish with some helpful tips to make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the fourth module of the second section. These are the learning outcomes you should be able to meet when you have completed this module. You should be able to apply your knowledge and understanding of standard laboratory investigations to select, review and appraise appropriate techniques. Prepare, process, analyze and interpret clinical laboratory data and present the data in a suitable format. Conform with standard operating procedures when working with specific laboratory equipment and demonstrate relevant practical skills. When you complete this module, come back to the learning outcomes to see and check that you have actually met them. This is the mandatory piece of evidence. The task is, produce a personal statement that demonstrates your experience of performing standard investigations, including your analysis of the data produced and evaluation of the decisions and/or referrals made. So to break it down, first part is asking you to produce a personal statement. So you need to write this evidence in a form of a personal statement. Next part of the task is asking you to demonstrate your experience of performing standard investigation. What standard investigations can you perform in your laboratory? Select a specific example from your practice. What is your experience in performing that investigation? Are you fully signed off and competent to perform this investigation by yourself? Or do you need to be supervised when performing it? What equipment or solutions are you using when performing this investigation? Remember, when you are writing about your experience, it has to be written as a personal statement. The next part of the task is asking you to include your analysis of the data produced. What data was generated during the investigation you performed? How did you analyze the data? Did you know how to analyze the data generated? How do you know the data generated was correct or incorrect? How do you know the investigation was performed correctly? Do you keep a record of generated data and your analysis? Consider SOPs, QC, KPI, documentation. The last part of the task is asking you to evaluate decisions or referrals made based on the data you produced. What decisions can be made based on the data you produced? Make those decisions yourself, or is it a responsibility of someone else? How would you know if there was a need for a referral? What referrals are available, if there was a need for them? IBMS also offers their advice on how to approach this mandatory evidence, which I think is very good. First information you are getting is telling you to write this piece in a form of a personal statement. Pretty straightforward. The next part of the advice is asking you to describe how you perform a specific investigation in your lab, using the analytical procedures your laboratory has in place. So select a specific investigation you performed by using standard analytical procedures your lab has in place, again pretty straightforward. The next part of the advice is asking you to clearly identify how you ensure that the equipment you use is fit for purpose. Think calibration, reference ranges, control material, training, quality and reliability of results this equipment produces. The next part of the advice is asking you to discuss the purpose of IQC and EQA associated with the investigation you performed. It would be a good idea to choose a procedure that has IQC and EQA associated with it, just a thought. What is the purpose of the IQC and EQA when it comes to the procedure you have chosen? Do you know what IQC and EQA control mean in the context of this investigation? What would it mean for the patient if they were not done or if they failed? Why do you do IQC and EQA for this test? The last part of the advice is asking you to include the evaluation of data produced. How do you evaluate the data you produced during this investigation? What does the data you produced mean? Do you know how to evaluate them? Now let's talk about the 8 SOPs that need to be covered by this piece of mandatory evidence. The first standard is, use their skills, knowledge and experience, and the information available to them, to make informed decisions and/or take action where necessary. To demonstrate this standard, you need to be able to use your skills, knowledge and experience to make informed decisions or take actions in your practice. How do you make informed decisions or take actions? Consider identification of issue, gathering information, analyzing alternatives, evaluating risks, being aware of consequences, challenging assumptions, taking actions if necessary. What skills, knowledge and experience do you have to perform, for example, a specific task? Consider your degree and the knowledge you gained, your practical training, your competence in this area, your previous experience and so on. How does this help you to make decisions or take actions? What else helps you to make decisions and take actions in your practice? Consider also your colleagues around you. The second standard is, make reasoned decisions to initiate, continue, modify or cease treatment or the use of techniques or procedures, and record the decisions and reasoning appropriately. To meet this standard, you need to be able to make decisions about the use of treatment, technique or procedure. You need to include why this treatment, technique or procedure was selected, why you continue using it, why are you modifying it, and why have you decided to stop using it. You also need to be able to record those decisions with appropriate reasoning. Consider responsibility, accountability, reviewing contingency plans, decision-making, justification of your actions, acting within your consent scope, identify risks, acting in patient's best interest, using relevant documentation, applying systematic approach, troubleshooting, training, competence. The third standard is, make and receive appropriate referrals, where necessary. This standard again is pretty straightforward. Show that you can make and receive appropriate referrals where necessary. What referrals can you make or receive in your laboratory? How would you make or deal with received referral? When making referrals, consider necessity assessment, gathering information, taking prompt actions, informing relevant individuals, providing documentation, and so on. When receiving referrals, consider evaluation of appropriateness, documentation review, continuity of service, feedback, and so on. Also consider best practices like secure sharing of information, confidentiality, data protection, professionalism, handling unclear outcomes, communication, use of proper channels, and so on. The fourth standard is, be able to evaluate analyses using qualitative and quantitative methods to aid the diagnosis, screening and monitoring of health and disorders. To meet this standard, you need to be able to evaluate results using qualitative and quantitative methods to aid diagnosis, screening and monitoring of health and disease. Qualitative and quantitative methods, and do you use them in your department? How do they aid diagnosis, screening and monitoring? Consider qualitative methods and their sensitivity, specificity, reproducibility, accuracy, cutoff points, data collection, results, subjective assessment. Then consider quantitative methods, their precision, accuracy, statistical approaches used, reference ranges, quantitation, limits of detection, control material used, calibration and objective data. The fifth standard is, gather appropriate information. This one is as straight as it can be. You need to gather appropriate information. How would you gather appropriate information in your laboratory, in relation to performing standard investigations? How would you know the information or result is appropriate? Consider objectives, source identification, collection methods, credibility evaluation, information processing, avoiding bias, ensuring accuracy, references, evidence-based, relevance of information, resources of information. The sixth standard is, analyze and critically evaluate the information collected. This standard links closely to the previous one. You need to be able to analyze and evaluate information you collected in association with performing standard investigations, to meet it. How do you analyze and evaluate information you collect performing standard investigations? Consider quality assessment, relevance of information, context, validity, reliability, accuracy, authority, credibility, possible bias, pattern identification, evidence comparison, contrast findings, questioning assumptions, evidence-based approach and robustness. The seventh standard is, select and use appropriate assessment techniques and equipment. Another straightforward one. To meet it, you need to select and use appropriate assessment technique and equipment. How do you select appropriate technique and equipment when performing standard investigations? Consider clinical details, ease in question and clinical history to narrow down the techniques you have to use. Establish whether the assessment is diagnostic, predictive, prognostic or therapeutic. Select appropriate reagents and equipment, use relevant control material and so on. Try to justify why you have chosen specific technique and equipment, explain your reasoning. The eighth standard is, undertake and record a thorough, sensitive and detailed assessment. Straightforward one again. To meet it, you need to undertake and record a thorough, sensitive and detailed assessment when performing standard investigation. Consider adherence to SOPs, quality controls, professional guidelines, document control, sensitive information and communication, detailed result generation and recording. Those are the standards you have to keep in mind when writing your mandatory evidence. They should all be demonstrated in your mandatory evidence. So now that we have finished with the mandatory evidence, let's have a look at the choice evidence 2 and 3, which are candidates' choice evidence and Q&A set by the trainer. They both together have to meet 19 HCPC standards. And if you download the module descriptors for the registration portfolio from the IBMS website, you will find some example evidence suggested by the IBMS, which is very handy. Let's explore the 19 HCPC standards that have to be addressed by two pieces of choice evidence. The first standard is, recognize the need to manage their own workload and resources safely and effectively, including managing the emotional burden that comes with working in a pressured environment. To meet this standard, you need to be able to need to manage your workload and resources safely and effectively. This includes managing the emotional burden that comes with working in pressured environment. Why is it important to manage workload and resources? Consider stress reduction, job satisfaction, quality, productivity, efficiency, adaptability, preventing burnout, reducing chronic stress, promoting balance, enhancing focus, increasing confidence, or meeting deadlines. How do you manage your workload and resources in your practice? Consider prioritization, triage, delegation, allocation, technology, automation, boundaries, communication, team collaboration, time management. When it comes to resources, think budget, ordering, stock monitoring and use, sustainability, waste. How do you manage your emotional burden when working in pressured environment? Think boundaries, prioritization, communication, seeking help, mindfulness, breathing, breaks, focus, perspective, hobbies, relaxation, journaling, professional help and so on. The second standard is, understand the theoretical basis of, and the variety of approaches to, assessment and intervention. To meet this standard, you need to understand the theoretical basis and variety of approaches to assessment and intervention. The theoretical basis for assessment and intervention in pathology is discipline-specific and is about understanding the underlying disease processes or pathophysiology, analyzing various sample types, investigating various diseases, using various evidence-based tests, methodologies and instruments, interpreting various results to support patient-centered care. What is your theoretical knowledge about diseases investigated in your department? What do you know about the approaches to assessment used in your laboratory? What do you know about the approaches to intervention for those diseases? Demonstrate your theoretical knowledge. The third standard is, understand the techniques and associated instrumentation used in the practice of biomedical science. To meet this standard, you need to understand the techniques and instruments used in BMS practice. Consider various disciplines within pathology, samples they receive and instruments or techniques they use. What do you know about techniques and instruments you use in your practice? How do they work? What do they detect? What do generated results mean? Try to use examples from your own practice. The fourth standard is, undertake or arrange investigations as appropriate. This one is straightforward. You need to undertake or arrange investigations as appropriate. What tests or investigations do you perform in your laboratory? Consider your discipline-specific investigations. What diseases are investigated? what types of samples you receive, what methodologies are available to perform investigations, what results are generated and how are they evaluated. Also consider your training and competence. The fifth standards is, conduct appropriate assessment or monitoring procedures, treatment, therapy, or other actions safely and effectively. To meet this standard you need to conduct assessment, monitoring, treatment, therapy, or other actions safely and effectively. When you perform a task in your lab, how do you know you are performing safely and effectively? Consider SOPs, quality controls, calibration and equipment maintenance, risks and hazards associated with the task, PPE, solutions used, scope of practice, ethics and conduct, training and competence, documentation and result interpretation or referral. Sixth standard is, perform and supervise procedures in clinical laboratory investigations to reproducible standards. To meet this standard you need to perform and supervise procedure to reproducible standards. How would you perform and supervise procedures in your practice to reproducible standards? Consider following the SOP, validation and verification, quality control, training and competence, calibration, traceability, automation, monitoring, auditing, troubleshooting, ISO standards, GLP or EQA. The seventh standard is, operate and utilize specialist equipment according to their discipline. Another straightforward one. Show that you can operate and utilize specialist equipment according to your discipline. What specialist equipment can you use and utilize in your department? Can you explain how the equipment work? When would you use it? How would you check if it worked okay? Can you perform routine maintenance? Consider discipline-specific equipment, your training, competence, acting within scope of practice, risk assessments associated with the equipment, manufacturer's instructions, safety standards, SOPs, maintenance, servicing or calibration. The eighth standard is, validate scientific and technical data and observations according to predetermined quality standards. To meet this standard you need to validate data and observations according to quality standards. How would you validate data generated in your laboratory against predetermined quality standards? Consider ISO standards, UCAS accreditation, QMS, training and competence, IQC, EQA, equipment maintenance, performance reviews, reference ranges, control materials, safety and integrity of generated data, proficiency, audits, error logging and responding to abnormalities. The ninth standard is, demonstrate proficiency in practical skills in cellular science, blood science, infection science, molecular and genetic science and reproductive science, where appropriate to the discipline. To meet this standard you need to demonstrate proficiency in practical skills in your discipline. How can you demonstrate proficiency in your practical skills? What practical skills can you perform in your department? Consider direct observation, day-to-day tasks you are trained on, audit, quality assurance, equipment operations, record keeping, compliance, supervision and training. The 10th standard is, demonstrate practical skills in the processing and analysis of specimens including specimen identification, the effective storage on specimens and the safe retrieval of specimens. To meet this standard you have to demonstrate your practical skills in processing and analyzing samples. This also needs to include sample identification, effective storage on samples and safe sample retrieval. How do you process and analyze samples in your laboratory? How can you identify samples? How do you store samples, before and after analysis? Can you retrieve samples safely? What techniques can you use during sample analysis? This is very discipline-specific, so consider steps taken during sample processing and analysis, checks during sample identification, storing samples before and after analysis and the effects of storage, environmental controls affecting sample storage and viability, retrieval of samples, sample tracking and inventory, traceability, documentation, and LIMS system. The 11th standard is, demonstrate practical skills in the investigation of disease processes. Another straightforward one. To meet it you need to demonstrate your practical skills during investigation of disease processes. What is your knowledge about disease processes for diseases investigated in your department? What skills do you have when investigating those disease processes? What equipment can you use? What methods can you perform and why are you performing them? What do those methods detect in association with disease processes? Consider safe handling of samples, proficiency, critical thinking, quality assurance, following SOPs, using and maintaining equipment, understanding methodology used, documentation, result interpretation, understanding pathophysiology of diseases, linking results to disease processes and so on. The 12th standard is, work in conformance with standard operating procedures and conditions. Straightforward one again. To meet it you need to work in conformance with SOPs. Do you follow SOPs when you perform tasks? If so, why? What could happen if the SOPs were not followed? Why is it important to read and acknowledge SOPs? Consider safety, risk reduction, quality control, consistency, reproducibility, accuracy, validity, uniformity, efficiency, training, competence, documentation, and regulatory compliance. The 13th standard is, demonstrate operational management of laboratory equipment to check that equipment is functioning within its specifications and to respond appropriately to abnormalities. To meet this standard you need to demonstrate you can manage laboratory equipment, you can check it is working within specifications and you can respond appropriately to abnormalities associated with equipment. What equipment can you use during your practice? Do you know how the equipment works and how to perform maintenance, calibration, cleaning and so on? Consider calibration, verification, performance characteristics, maintenance, monitoring, servicing, troubleshooting, compliance, documentation or traceability. The 14th standard is, understand the implications of non-analytical errors. Another straightforward one, guys. To meet it, you need to understand the implications of non-analytical errors. What are non-analytical errors in your department? Consider pre-analytical errors before the sample is tested such as PID, contamination in sample, incorrect sample collection, transport, storage, or labeling. Consider post-analytical errors such as result misinterpretation, breach in turnaround time, or transcription error. Do you understand the implications of those errors on your practice and also on patients' care and outcome? Misdiagnosis, treatment delay, sample damage, patient harm, operational and financial burdens, legal implications, and so on. The 15th standard is, know the extent of the role and responsibility of the laboratory with respect to the quality management of hospital, primary care and community-based laboratory services for near-service user testing and non-invasive techniques. To meet this standard you need to know the extent of your role and responsibility of the laboratory for near testing and non-invasive techniques with respect to quality management. This relates to POCT, point-of-care testing devices and ROSE clinics, rapid onset evaluation. What role do you play when it comes to quality management of those devices and techniques? Do you use them in your practice? How do you maintain their quality? What role does your laboratory play when it comes to quality management of those? Consider calibration, maintenance, verification, validation, control material, documentation, safety, training and competence, accreditation, and so on. The 16th standard is, select suitable specimens and procedures relevant to service users' clinical needs, including collection and preparation of specimens as and when appropriate. To meet this standard you need to be able to select suitable samples and procedures that are relevant to service users' clinical needs. What clinical needs do users have when it comes to your department? What types of samples do you process in your lab? Do they need to meet certain requirements to be accepted for testing? What procedures do you use when you are processing samples? Can those procedures be used for all samples or only certain types and why? Consider laboratory handbook that provides you information for service users in regards to sample containers and procedures used during sample processing, clinical indications and history, guiding diagnosis and patient management, preparation methods available or impact evaluation. What role do you play in sample collection and preparation? The 17th standard is, demonstrate awareness of the need to assess and evaluate new procedures prior to routine use. To meet this standard you need to be aware of the need to assess and evaluate new procedures prior their routine use. Consider validation and verification, extension to scope, clinical safety, quality and risk management, trialing, feedback collection, result evaluation, and so on. Why is it important to evaluate new procedures prior routine use? Consider the impact on service users and your laboratory if this was not performed. The 18th standard is, use standard operating procedures for analyses including point-of-care in vitro diagnostic devices. To meet this standard you need to use SOPs for analyses, including POCT in vitro devices. Do you use SOPs during analyses? If so, why? Where can you find SOPs in your department? Why are they important? Consider patient safety, reliability of analyses, quality management, documentation, instructions, accuracy, training, and so on. What could happen if you did not follow the SOPs? Consider the implication for the service users and the department. The 19th standard is, safely interpret and authorize service user results. Straightforward one again. You need to safely interpret and authorize results. What results can you interpret and authorize? Why is it important to interpret and authorize results in safe manner? Consider your training and data assessment, confidentiality and clinical governance, scope of your practice, relevant documentation, and so on. Also consider the implication for the service user and your laboratory if this was not done safely. Always have those 19 standards in your mind when you are selecting a piece of evidence and then when you are writing it. Remember, all those standards need to be demonstrated in 2 pieces of evidence you choose. One more thing you have to include when choosing and writing your evidence. And that is the evidence justification. For the mandatory piece of evidence, the IBMS has provided a very good justification why they would want you to do that piece of evidence. I would strongly advise you to read their justifications as this can form the basis for how to be justifying your choice of evidence. You should also include what standards you have met by your evidence. Think about what type of evidence you have chosen, then think why you have chosen that particular evidence, and think which standards you are meeting with that evidence as well. These are some suggestions from the IBMS that could be used as the choice evidence in this section. They are pretty good and can meet several standards, which is what you need. And these are types of evidence ideas I would also suggest. Again, they can meet several standards as well, which is the goal. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the verifier. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help as well. Also try to use various types of evidence, not just one type, like case studies, for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiment. If you like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the standards that are within this section and how to meet those standards with relevant evidence. And my final take-home message? Keep those standards in mind when selecting and approaching your evidence. Bye for now.